This presentation will be about pathological fractures linked to cancer. What is a pathological fracture? Well, we know patho means disease and a fracture means a crack or break in the bone. So when we put these two terms together, we can then link that a pathological fracture is a crack or break in the bone that comes from a disease. Bone metastasis. We will be talking about cancer spreading to the bone, causing weakening or strengthening of the bone that causes it to break. The spread of cancer into the bone is called bone metastasis. The spreading of cancer cells. First, cancer cells break away from the original point of growth, and then they spread through the bloodstream or lymphatic system. Next, the cancer cells will attach themselves to a blood vessel or a lymph vessel to move through to another organ. Most common place for these cancer cells to spread is the skeletal system. This is because these cancer cells need a rich blood supply and a growth ground that allows them to dominate the area. Bones help them do this. Then the cancer cells usually attach themselves to long bones because they have the greatest blood supply, like the upper arms, the pelvis, the thighs, or the spine. When cancer cells have finally reached and settled in the bone marrow, they continue to grow and multiply. Mets of the bone. These cells then create holes in the bone called osteolytic lesions or osteoblastic lesions. This process causes the bone to weaken, and then the lesions occur, which causes the bone to break on its own. Osteoblastic lesions, cancer cells stimulate osteoblasts. What happens is these osteoblasts causes hardening of the new bone on top of old bone before that old bone can be broken down. Usually when this happens, the abnormally hardened bone forms blastic lesions that break more easily than the normal bone. These changes in the bone result to the bone's weakening, where then a pathological fracture could occur. And this is usually the first sign in bone metastasis. Depending on the condition of the bone, these fractures could occur in an accident or on its own. How fractures affect the body. Due to the weakening of the bone from cancer cells, we have to watch out for reverse effects throughout the body when the bone fractures. If a bone is fractured, it could cause calcium to be released, which leads to high blood calcium levels, also known as hypercalcemia. Hypercalcemia could affect your kidneys, abdomen, muscles, skeletal system. These organs can be affected that can cause symptoms such as loss of appetite, nausea, thirst, constipation, fatigue, or confusion. Calcium helps regulate your nervous system, which would be why confusion could become a possible side effect. Also, if the bone marrow is affected, symptoms of lower blood counts could result. Red blood cells could drop and cause the risk for anemia. White blood cells, if they're affected, infections can occur, which then could be low platelets occur. There's easy risk for bleeding and bruising, which low platelets you usually see in cancer patients. And then there might be damage to the nerve, blood vessel, and to the periosteum in the bone. Some signs and symptoms of these fractures, they can be found visibly, physically, or through many different types of tests. Such as x-rays. You could see swelling, bruising, even deformity. You have some physical symptoms that could include pain and inability to use the limb. These are the types of bone fractures. We have transverse, linear, non-displaced, displaced, spiral, green stick, and communid. Some of the treatments of pathological fractures include, depending on the type of fracture, the classification, like the closed or simple fractures, you have open or compound fractures, or you have long bone fractures. I listed some things here. One common treatment in closed or simple fractures are cast, which, maybe yourself or people you've known have gotten a cast that, immobilizes the limb to help the callus, which is the weaker temporary bone, be replaced with new real bone. In open or compound fractures, the site is cleaned thoroughly, then a cast is applied for proper healing. Lastly, there's long bone fractures that are most commonly healed with internal nailing. So the more trickier long bone, like your femur, you would have some nailing in there to keep it in place. Prevention. Doctors hopefully diagnose and treat the primary cancer before it spreads to the bone. There are no preventions for fractures at this time. Mainly the biggest prevention is, from getting a pathological fracture is not smoking, eating healthy diets, just kind of avoiding major things that are a role in getting cancer altogether. Some consequences would be injuries to organs, tissues, or surrounding structure. That could lead to blood loss and stunted growth of the bone if a fracture occurs in a child. You have hypercalcemia, like we talked about earlier, that causes a lot of harm to your kidneys and has quite a lot of side effects. Then we have, if it goes untreated, you could possibly have long-term effects resulting in long-term dementia. Some consequences, more consequences. The fracture could reoccur, which is called distant recurrence. Cancer cells can just break off and survive treatment and spread to other parts of the body, and it could cause another break. Severe fractures can cause nerve damage, which can lead to circulation problems, maybe potential numbness. Even with proper medical attention, some pathological fractures may not heal properly, which leads to ongoing tightness and maybe possibly arthritis. In conclusion, there's many complications, risks, and offsets within the body when it comes to what you might think be a simple fracture. With having cancer and risk of these fractures, there are many things to put into consideration, and I hope you now understand how a pathological fracture is caused, what's affected, and how it's affected. Remember, stay in tune with your body. If you notice something out of the ordinary, like a bruise, soreness, trouble operating a limb, visit your local doctor and get those tests. Prevention is key. Thank you very much.